In an effort to reduce the number of positive COVID-19 infections among pregnant and breastfeeding women, the Ministry of Health on Thursday rolled out a targeted vaccination campaign for this cohort of the population. To this end, it was noted by the Minister of Health, Dr. Frank Anthony, that while the Pfizer vaccines will be available to these women at public medical facilities, these doses will also be available at a number of private hospitals. As such, on Friday, Nightly News visited the Woodlands Hospital located at Carmichael Street, Georgetown, to solicit the views of a few of the women who were there to access the life-saving jab. This newscast was told by Deborah Francis that while her son is over 1 year old, he continues to breastfeed. As such, she decided to take the jab. She noted, however, that earlier on she was a bit skeptical about the vaccines and its safety for her child, but through extensive research she was able to ascertain the efficacy of the vaccines.
Because I had reservations about being vaccinated, considering that I'm breastfeeding, and the data didn't really reflect any sort of confidence for me. So now that I know Pfizer is available, I know in the US they have authorized Pfizer for breastfeeding mothers. So since I learned that Woodlands is offering Pfizer, I thought, why not?
Francis shared the belief that it is important for pregnant and breastfeeding women to follow the science rather than believe in the myths that are being peddled on social media.
So I think we all have to be guided by science and not what your friends are saying and your parents and your family and so on. So I think the science speaks for itself. The science says, as we speak, that the vaccination is safe for pregnant women as well as breastfeeding mothers. And I think we should be guided by that. I think that should be our fundamental argument.
She is adamant that the risk of contracting and possibly dying from COVID-19 far outweighs any complications that can be caused by the COVID-19 vaccines. Unlike Francis, this pregnant woman who opted to speak off camera believes that women should do their own independent research.
But I did my own research and I believe that is the safest. And the thing is, vaccine doesn't necessarily stop you from actually contracting COVID. You still have to follow the guidelines and so on.
Now 34 weeks pregnant, she is adamant that getting vaccinated against COVID-19 is the right decision.
Because it's worse if you contract it and then you have to be in that institution. You won't be able to get the best care in terms of, you're accustomed to whatever doctor and so on. So it's a hard decision to make, but I think it's probably the right decision.
Additionally, another young mother who also opted to speak off camera told Nightly News that she chose to get vaccinated against COVID-19 to keep her unborn child safe.
I want to be safe. I want my unborn child to be safe when he or she gets into this world. And that's the most basic concern I have for our safety.
Meanwhile, pediatric doctor at the Woodlands Hospital, Dr. Hardat Prasad, like many other medical professionals, shared the view that the vaccines are safe for this cohort of women.
My own daughter, who recently had a baby, and the baby is now 2 months old, during her pregnancy in Canada, she took the Pfizer vaccine, of course twice, 2 doses, and she had no issues, absolutely. Out of all the people who I've known in my clinic who took the vaccine during early pregnancy, just a little before the pregnancy, and during the full-blown pregnancy, none of them had issues. I had a look at their babies, I had a look at them when they were after delivery, and they had no issues at all.
It is therefore important for pregnant and breastfeeding women to trust the medical professionals when they say that the vaccines are safe, Dr. Prasad said. He encouraged women to conduct their own research using only credible sources before they make a decision. The Pfizer vaccine doses will be available at the Woodlands Hospital for all pregnant and breastfeeding women weekly on Mondays, Wednesdays, and Fridays. However, persons are required to make an appointment. The requirements for pregnant mothers are proof of identification and a clinic card. Breastfeeding mothers will need to provide a proof of identification and the child's clinic card or birth record. The hospital expects to vaccinate a maximum of 50 pregnant and breastfeeding women daily. For the HDP 90 News, Kendell Richmond.